On. Hey everyone, welcome to Revolutionary Health. I'm Charles Stevens, the Executive Director of the County Project. I'm joined with
David Malebranche. How you doing?
no fancy title today.
There's no fancy title today.
I like the resident physician. Was it?
I like to change it up. Let's go.
How are you doing today, David?
I'm doing okay. I've had some challenging things happening and dealing with some interesting things. But not going to get weighed down and going to try to. There are a lot of brothers who are going through a lot of stuff right now, and it's just about kind of lifting people up. So I'm just letting people know out there who are going through whatever we go through. Reach out to your loved ones, and to everyone else, reach out to the people that you think are doing well according to social media, Instagram, Facebook, Snapchat, whatever you're on, and check in with them just to make sure. A lot of people put up fronts and will put up their good face, but check in with everybody, see how everyone's doing.
Absolutely. That's been our ministry for a while now.
Yes, sir.
We are on.
Okay. So should I start all over?
Sorry for the technical difficulty.
Right.
The internet gods are not on our side this evening, but it's okay.
I'll probably pick up where I left off.
Yeah.
Yeah. So we were talking about sleep apnea, and the test you have to do is what's called a sleep study. You go overnight to a facility. It's usually a pulmonologist or a lung specialist that is the one that coordinates this. And you stay overnight. Sometimes they'll do it in 2 nights. The first night, they attach a bunch of wires to you and find out how many times you stop breathing during the night, and also what your levels of oxygen are during the night. Once they calculate that, they either have you come in a second night, or at some facilities, they'll do 4 hours where they calculate your oxygen levels and how many times you stop breathing. And then they wake you up and they fit you for what's called a continuous positive airway pressure mask, or what's called a CPAP. And everyone knows it as CPAP. They fit that to your face, and what they do is figure out how much pressure they need to kind of put in your mouth and your nose to keep that airway open so you're getting enough oxygen at night. And then once they have those calibrated settings together, then they actually send you home. You get the CPAP, and you have to wear that at night to help. The CPAPs used to be really bulky. I remember I used to date somebody. One of my major relationships was with this brother who had really bad sleep apnea, and he wore this mask, and it was kind of like the face huggers on Alien.
Wow.
And it was like, it was all over, and he hated wearing it because it was such a nightmare. The technology, that was like 15, 20 years ago. The technology has improved now, so that now they're a little bit smaller. They go in the nose. They're very compact. They come in a little compact case. And they don't make as much noise. They're not as uncomfortable. And so a lot more people are doing it. However, a lot of people just don't like wearing those masks. It's not sexy. Somebody who's trying to like mess around in the morning and someone has the mask on, it's, well, it may be a turn on for some, who knows, but it could be something where you could use something freaky with it. But a lot of people don't really like how it feels, and they don't feel sexy wearing it. So there are other options. Sometimes they will do surgery. And so they'll cut out some of the tissue on the back of your throat if it's extra tissue, either from being overweight or having extra tissue genetically. That surgery, however, works maybe 50% of the time, so it's a coin flip. So some people don't think the risk of going to surgery for that is worth the benefits. And then there's another recent discovery that has come out where they actually have an implantable device that they put under your skin in your chest, and it has a wire that goes to your hypoglossal nerve, which controls how relaxed your throat and your tongue is. People basically turn this device on before they go to bed. And then when you start to snore or your tongue drops in the back of your throat, it releases a mild stimulation to the back of the throat and to that hypoglossal nerve that relaxes it. So it allows your airway to relax, allows you to breathe better, get more oxygen in. So if you're suffering from any of this, one of the indications that they say may tell you you're at risk for sleep apnea is actually your neck size for dress shirts. So if your neck size is 17 or above, you may be at risk for sleep apnea. And like I said, if you have symptoms like headaches, feeling tired and sleepy, and falling asleep at the drop of a hat during the day, and if you snore very loud, those are all telltale signs of this. People just don't realize it, but if you let it go for years and years, your blood pressure goes up because of it, because your heart is always straining to keep up with the lack of oxygen. Your joints end up you get arthritis quicker, and then your heart can go into failure at some point. And so it's really an important condition that not a lot of us know about. I don't have any breakdown as far as demographics racially, whether Black men are at increased risk, but it is something that I see a lot of us suffering from a lot, and we just don't know. So I think it's something to kind of keep aware of. And if you need to kind of look up the symptoms and see whether you need to ask your primary care provider or someone else about it.
So what would be the first step? Would it be going into?
Yeah, I think probably going to a primary care provider, mentioning it to somebody that you see, and then having them refer you to a lung specialist, or they can refer you directly to get the sleep study. And so if you want to get the sleep study directly from your primary care provider, you can do that.
When someone goes to see a doctor, that think they might be suffering from sleep apnea, what are some of the questions they should ask?
I think if they go, well, the specialist would be a different thing, but if they think they have sleep apnea, the first question is going to be, can I get a sleep study? And so that's going to be the main thing, because otherwise we're just guesstimating. The other thing too that I don't mention, we're in allergy season. And so a lot of times, think about it this way, people start having worsening sleep apnea when they're congested through their nose, because not only can you not breathe through your nose, but you can't breathe through your mouth either. And so at night, you're essentially getting no air in or out. You're not getting enough oxygen. You're not releasing the carbon dioxide. And that's a recipe for disaster. So when you go to your doctor's office, like, tell them some of the symptoms you're having, ask about getting a sleep study, and then they can refer you and kind of take it from there. As far as treatment options, that's going to be up to you. A lot of people go with CPAP. That's the most non-invasive part. But like I said, for some people, it's uncomfortable. Surgery, if that doesn't work, and then this new procedure, I think it's called Inspire or something like that, where they put the device underneath here that releases that that nerve stimulation to your neck. So I know one person that's actually gone through that procedure.
And how was that been for?
Not that great.
Oh, wow.
Great for the sleep apnea, but had some other complications with it. So it's something to look into. Again, it's called Inspire. And so if you look up anything, even WebMD may have a decent section on sleep apnea. But if you just look up some information, you can see the signs and symptoms. You can see some of the potential treatments, and then go from there. And there are other things, like you hear on commercials, like I have Sirius XM. So, you know, there's this guy that talks about Zipa. It's Happy Z spelled backwards. I can't vouch for any of these, or these nasal plugs that kind of go in the nose and do different things, or things that you've put in the mouth that kind of open the jaw, supposedly. There are a lot of different things that are out there, but not all of them are FDA approved or have been studied for years. They're just there to make money for whoever's making the product. So be careful with some of these, kind of quick interventions that people think may work for it. So.
All right, everyone, make sure that you like this video on Facebook if you're watching it on Facebook. If you're watching it on YouTube, please subscribe to our YouTube channel and like the video on there as well. And as always, please, in our comments, let us know what you think. Let us know, do you have any questions about sleep apnea? Do you know anyone that's experienced sleep apnea? Do you yourself have sleep apnea? And what have you found to work? So please let us know in the comments. Quick roll call. Maurice Franklin. Maurice says, hello, leaders. Hey, Maurice, leader yourself. Daniel Drippin, Emily Halden Brown, and Art Jackson.
Hey y'all.
Hey y'all. Hey everybody. CNP tribe. Another topic
you're gonna bring it up. Come on, you know you want to talk about it.
Okay, so
you go see Charles perk up now, because this is an interesting topic.
I was already perked up. I mean,
wait, let me sip this tea.
David Shade. Dr. Shade, I can't even deal with it. So anal health.
Sure.
We talked about, we've gotten some questions about, and I know the final thing I want to talk about too, by the way, but I know this is I know people watching is like, you're talking about sleep apnea, you want to talk about anal health.
We can talk about whatever we want to, because this is revolutionary health, and it's all over the map. There's no paradigm to this.
The revolutionary health will be televised.
That's right.
Bleeding.
Yeah.
In anal health, if someone wants to be penetrated, they're interested in being penetrated. I guess the question is, should they be concerned if they're bleeding in their rectum after having anal sex? Like, what receptive anal sex?
Are you going to explain to the audience like why this came up?
No.
Okay. All right. So
it's not a personal experience.
No. It's not that. But like the story.
But if it were, it would be okay too, because we talk about it.
But the story that kind of got you.
No.
Okay. So yeah, rectal bleeding. If you bottom and you notice some bleeding afterwards, obviously it's a concerning sign. Some people think it just may be kind of a tear, or somebody kind of fucked you too hard. And so you're basically like, what happened? Why am I bleeding this way? Uh, there are so many things that can cause rectal bleeding. I think the two most common ones are going to be hemorrhoids and fissures. And hemorrhoids are just dilated blood vessels. It's usually because you're dehydrated or you may be constipated. Um, and you're not going to the bathroom enough, you're not taking shits enough. So what happens is that the blood vessels kind of get engorged, they're full, and the blood can't get back to the heart. So some of them peek out the anus, and some of them stay inside. And so for a lot of people, they may not feel the ones that are inside because they're not typically painful. But when you bottom for somebody, if someone's penetrating you and hits one of those veins, they can cause some bleeding. If it is rectal bleeding from the area of the rectum, it's going to be more bright red blood than anything. So you'll notice it when you're wiping down. And the general rule of thumb is that the longer something has to travel from your stomach kind of to your anus, if it has to travel a long period of time, it goes through an oxidation process. So the blood's going to be darker. So if you have an ulcer in your stomach and that's what's bleeding, it's going to come out really dark black or dark, like a very dark tarry maroon color, something like that. If it's coming right from the rectum before you go to the anus, it's going to be more bright red. So hemorrhoids are one thing you can think about. The other thing is what's called a fissure, which is actually a tear in the muscle wall. Hemorrhoids are different from fissures in that fissures can cause much more severe symptoms. And so people who have fissures, you bleed a lot more. The pain is a lot worse because you imagine a tear in the muscle. And so every time you have a bowel movement, every time you're taking a shit, it's really, really painful. And then there's a symptom, a medical term called tenesmus, which when you're anticipating the pain so bad that you're scared to go to the bathroom because it's going to hurt and because you know it's going to bleed. And so every time you have a bowel movement, it kind of rips open the scab or tears at the muscle, and then the muscle goes, it opens up and you bleed a little bit more. Both of these things are not necessarily caused by bottoming. So I don't want people to think that if you bottom, that's going to be the reason why you have hemorrhoids or fissures. It's actually not. Sometimes people can have high blood pressure. A lot of people I know who are tops have never had anyone penetrate them in their life, have had fissures. So it's not necessarily the cause of it. So I don't want people to think automatically that, hey, if I bottom and if this brother's too big and kind of digs in a little bit too hard or goes too heavy, that this is going to cause me to have hemorrhoids or fissures. It may or may not. It may be related. It may not.
What if someone really enjoys being like rough sex,
right
and being penetrated very roughly, like what are some things that they should, are there things they could do to sort of
lube the hell up? That's what you can do.
So lots of lube.
Lube that up as much as you possibly can so it can take that, because something like a silicone-based lubricant, water-based lubricants are going to be good, because they'll be a little bit smoother. And so that will hopefully help out. If somebody likes rough sex, gets turned on by the bleeding, you just have to be a little bit careful, because think about it. If you're bleeding in the rectal area, that's where shit is coming down. Shit has bacteria in it. So if bacteria gets in the bloodstream, you could get, or it gets lodged inside the muscle wall, you can have an abscess or an infection that kind of digs into the wall. And I've seen people with what are called perirectal abscesses, where an abscess and a collection of pus and infection goes within the rectal wall, and those are very painful and require surgery. So, and again, we think about STIs as well. So HIV, hepatitis B, hepatitis C, all those things need to get in the bloodstream in order to do that. So if you're having rougher sex and you're bleeding a lot, not only is that a risk for your anal health just in general, but it's also going to put you at higher risk for getting all these STIs. So you really have to be careful with that. So I think, whether it's someone that enjoys it as far as a pleasurable standpoint, whether they enjoy the blood aspect of it or they just enjoy the rough sex of it, I think it's something to be careful about. And if you notice anything that's different from your norm, or kind of straying from your norm as far as your bowel movements, if you're bleeding much more, if you're wiping yourself at night and the tissue is showing up blood, then you need to go be seen by somebody.
Maurice Franklin has a question. So would Preparation H help or exacerbate?
Preparation H, most colorectal surgeons will tell you not to use Preparation H because it actually makes it worse. Don't use Preparation H. It's not a good one. I've spoken to 2 or 3 colorectal surgeons about this in the past, and they recommend there's an ointment called Calmoseptine, Calmoseptine. I sound like one of those fifth graders in the spelling bee. But it's called Calmoseptine. It's a Vaseline-based ointment, and you would apply that to that area every 4 hours, kind of as needed. The other things you can do if you have hemorrhoids, what we call sitz baths, which is just you fill the tub up with a certain level of water, just a few inches of water. You sit in it for about 10, 15 minutes, and it's just going to be soapy, warm water. What that does is it helps to relax the muscles, and it actually opens up the blood vessels so you can heal a little bit more.
Wow.
But it relaxes the blood vessels. So whether it's a fissure or whether it's hemorrhoids, if you're bleeding, that's something you can do. Now, a lot of people say, well, I don't have a tub in my apartment or my place. There is something you can get from a pharmacy, anything like Walgreens, CVS, those kind of things. And it's called a sitz bath, and it's spelled SITZ, a sitz bath. And what it is, it's kind of a toilet cover that you'll put on the toilet, and it has a basin where there's some water underneath it. And you can actually even hang an IV. They give you an IV bag where you can have warm water go in there. And then you basically put that on the toilet and you sit in it. And it's just, if this is your ass, you just want the water to kind of be right at the tip of your ass around your anus and kind of allowing those muscles to relax. So again, warm water. Some people use witch hazel. I can't advocate for that one way or the other, but some people have talked about witch hazel works to kind of relax that. Some people have used Epsom salts. I wouldn't use Epsom salts because those may probably bother or irritate if you have any bleeding or any kind of lesions that are inside of the anus. So I think those things are important things to look at.
When should you consult a physician?
I would say I'm one of those people, like, immediately if you're noticing some blood, I'd go be seen by somebody.
So
and especially,
you go to Walgreens,
especially if it persists. Then I would say if you notice a little bit of bright red blood on your toilet paper when you wipe yourself, you can do some things at home. So increase fiber in your diet, they say. Stool softeners like Colace, Dulcolax is a good one as well. Miralax is a good one. Anything that's going to prevent you from being constipated. Drink a hell of a lot of water, 1 to 2 liters daily, and then the sitz baths. Those are kind of the 4 things that I recommend to people that they can start off at. If the bleeding continues, then obviously you're going to want to see somebody. But there's some things you can do at home.
And how long should you wait before you get penetrated again?
I would give it a few days, maybe 3 or 4 days to a week.
And a 7-day week or a 5-day week?
A 7-day week.
Okay.
I would tell people a 7-day week.
So if someone's bleeding, so if you find that you have a fissure or hemorrhoid, you should wait.
Yeah, wait a few days and kind of give it a rest, and don't initiate any trauma in there. Give it about a week. Sometimes with like scarring and fibrotic tissue can kind of come and seal a wound in there and make it a little bit better. You just don't want any trauma. So I mean, don't see it as always a bad thing. You can use it as a way with your partner or partners to kind of investigate other ways to do stuff, and other ways to get off, other ways to get a nut besides, penetration. So you can explore other things. So see it as an opportunity, put the silver lining on it, make lemonade out of lemons, do whatever you need to do. But like, rectal bleeding is something you should check out. It's not normal. It's not natural. And so make sure you check it out. And again, I'm talking about bright red blood. Talking about ulcers or what would be a risk for colon cancer or what would concern you about colon cancer is a completely different story. This is more about the bright red blood that comes from the rectum.
So definitely ask questions in the comments. So let us know what you think, maybe your experiences or folks that you know around anal health. And, this is an opportunity to just kind of, what are some of the biggest sort of myths that you find that people have about anal health? Like one of the myths I heard when I was really young.
Asses come. That's the biggest myth I've heard about anal health.
Really? So the asses don't come?
Asses don't come.
Really?
Yeah.
Could you say more about that?
Let's dispel that myth right now. So a lot of people will say, I hear a lot of guys will say, oh, my baby likes me because when we're screwing, my ass comes. Like I come. And he's like, oh, baby, that turns me on because it's like a pussy. You come. And I'm like, so asses don't really come. There's not any kind of ejaculate or fluid that comes out of it. However, if it's kind of a mix of pre-cum, lube, and then you have sebaceous glands that secrete a little bit of fluid inside the rectum, then some fluid will come out, or something that will come out that people may think is cum,
Okay.
but it's not cum. But I think that's part of like
I think we've just disappointed a lot
like
of
a million people, yeah, because people would be like, "Oh,
Santa Claus doesn't exist."
I'm like a woman. I can come through my ass." No, you can't really do that. But some people may have glands that secrete more fluid than others. And so that's why some people may think that they're actually coming when they do this. But physiologically and from the perspective of anatomy, there's nothing in your ass that is equivalent to you coming or having an orgasm from your dick. So I can squash that right now. But I think if you want to have the fantasy of that while you're involved in,
it's like,
and while you're involved in sex, go ahead and have that fantasy.
It's like role play.
Yeah, go ahead and do that and claim that and do that. But just know that you're not really coming when that's happening.
You know, the first myth I heard was when I was in high school. Like, well, my first sort of like gay mentor figure.
Mm-hmm.
He said that small dicks give you hemorrhoids if you're being penetrated.
I don't know about that.
Yeah, I think that was fake news.
I don't know. I think that could have been fake news.
But that's what he seemed to have very strong feelings about.
Yeah, I don't know.
And, maybe
it's
intertwined with his sizeism, I think, as well, because he was also he had a strong affinity for
larger.
Yeah.
Okay. Yeah. So maybe it was his personal experience that smaller dicks caused him hemorrhoids, but there may not have been causality, maybe an association, but not there's a correlation, but not causality.
We teach public health on here too.
Exactly. So we give you definitions like correlation and causality. Right.
What are some of the myths that you heard? Because I know I'm laughing and stuff, but I mean, these myths are very serious and they have very serious consequences.
Sure.
As ignorance always does. So it's important that we dispel. What are some other myths about anal? And what are some of the myths that y'all have heard? Please let us know in the comments some things that you've later discovered were untrue or not true in your experience.
Yeah, I think the other myths would be about cleaning, like maybe douching or using enemas.
That's a big one, yeah.
And so it's not necessarily a myth, but although you're clean, you may actually be irritating the inside of your rectum, and so actually predisposing you to small little like micro tears or bleeding inside or irritation, where you could be at higher risk for contracting HIV or STIs if you do that. So a lot of people think, oh, I just want to be clean, and because I'm not painting the walls, because I'm not giving my partner a dirty deal, that's the end all.
Oh, we should talk
about
that.
That's the goal. Okay, we should.
Okay, so Dr. David.
Yeah.
What would you recommend? So let's say someone's in a sexual situation, and they find that there's been some fecal matter that
there's been some shit that's come out of the ass, right?
How? So a lot of times people are very shaming and they don't really know what to say. Do you have recommendations for how people can kind of like be not shaming or?
Yeah. See, what I would say, and like personally, I mean, this is me just being real. Like, I'm versatile, so I've been on both ends of that equation in the past. I think if it happens to you as the bottom, it can be embarrassing, and someone could stigmatize you or really do something. I haven't had that experience, and so I think when I topped, I did the same thing. Like, I didn't make it a big deal, because the way I look at it, it's an ass. Anatomically, an ass is made to get rid of shit and waste material. So you can clean it as much as you want, but you may not be able to anticipate your body like bringing something out during that moment. So you can't control it. So the way I look at it is that that's a natural bodily function. And so even if it's not 100% clean, there's no need to shame somebody.
Stop the shame.
Yeah, stop the shame on that, because it's just not productive for anything. And so, maybe you decide to take a bath together afterwards, or take a shower or something like that, or just clean up and then resume afterwards. For some people, it kind of ruins the mood. If it's a smell or if there's a lot of it, it may ruin the mood. And so that's a given. So you just have to kind of roll with that. And if someone is going to like dog you or shame you for doing that, then get rid of them. They don't need to do that. It's an ass. So it's not a pussy. It's an ass.
You know what someone used to say?
What?
His whole thing would be that a friend of mine would say that he would tell his that if it happened, he would tell his dates, "Boo, you spilled." That was his line. He had a spill.
You spilled.
That's what he used to say.
Yeah, that's not cute. That's still gonna be shaming, no matter how like fancy or kind of like nice lingo you put around.
Well, I think there's this whole I mean, our culture, like, there's always, I don't know if it's associated with the stigmatization of the asshole in general. But I
Right.
find that, and of course, there's like maybe it's rooted in like these sort of roles and heteropatriarchy and all these things. But ultimately, I mean, it really is connected to like a larger political reality. It's all
Absolutely.
connected. Yeah.
Absolutely. But yeah, I think it involves like it's a certain amount of extension of bottom shaming too. So like making someone
Yeah.
feel bad because they can't take dick or they're doing something and
Yeah.
they have a little bit of a spillage or they have a little bit of a mess. It's like stop the judgment, like it happens. So
Yeah.
get over it, wash yourselves off, get a washcloth, take a shower, do a bath, move on.
One of our commenters asked Art Jackson, so is eating ass healthy?
Yes, it is. I mean, it's an interesting question to ask, is eating ass healthy? Does it carry certain risks is maybe what they're asking. I'm paraphrasing and I apologize for that. I don't know whether I'd phrase it eating ass is healthy, but the way to medicalize it or kind of like talk about it from a health perspective is that you can give and receive certain things from tossing somebody's salad. And that's the phrase I'll use for eating somebody's ass. But you could get, like, if someone has hepatitis A or someone has another like intestinal infection, Giardia is one that's it's a parasite that's among a lot of gay men. Another one called Entamoeba histolytica
That
happens.
sounds like that sounds like a book in the Bible.
It sounds like a lot of stuff. Yeah, histolytica. It sounds like a New Testament
I know.
chapter. But like,
Histolytica 3:15.
so yeah,
thou shalt eat ass.
Wow, you were going straight to hell. So these things can happen, and what happens is that if you are eating somebody out, and even if they have cleaned themselves in this, there still may be remnants of the parasite or the virus in there. You can contract the virus, and that's why they recommend, like from a health perspective, for a lot of gay men, that we actually have the hepatitis A vaccine. That's one of our recommended vaccines, because if we're eating each other's asses a lot, that's going to be a higher risk. So you want to get the vaccination to protect yourself up front. The other thing is that gonorrhea, if someone has rectal gonorrhea, you can get it in your mouth. The same, or chlamydia, you can do from the mouth to the ass with chlamydia as well. Also syphilis, herpes, all those things are fair game, transmissible. So that's why I always tell people a lot of times, they talk about condoms and not penetrating, and a lot of us will use non-penetrative sex. Like, we don't have to fuck, we'll just do oral sex, oral anal sex, whatever. But there's still a lot of risks associated with that, and so you have to get checked out for everything and make sure you're okay. But I mean,
are there ways that, so what someone's eating ass, are there like ways that you recommend that they reduce?
Yeah, that's a hard one. I don't think I could.
Like, I know
that
some
one.
people would suggest saran wrap and like a barrier.
Yeah, some people would do that. I don't know whether that would actually protect, and I'd be lying if I were to say, well, that'll confer 50% protection. I don't know. So I don't know the answer to that question. What I will say is this: I'd rather be on the sex positive tip rather than just focus on the diseases. So when you ask me if eating ass is healthy, I'm gonna say yes. Yes, it is healthy. It's very sex positive. It's something you should be doing if you enjoy it, if your partner enjoys it, if you guys enjoy doing it to each other, or there's one role with this. But just know that certain things can happen. So obviously, if someone is just recently got over a diarrhea illness or food poisoning, you're not going to go down and eat their ass immediately. Like, common sense will tell you that. It's just a matter of kind of making sure you're staying sex positive and healthy, but then being aware of kind of what can happen.
We also have, so I think this is related to the point about there's not, your ass doesn't come or whatever. Right. But myth, does the ass get wet when aroused?
It can, yeah, with the sebaceous glands and the glands that are in there, and like with stimulation.
And it's triggered by sexual response.
It can be triggered by sexual response, or it may just be someone sweating. Like if someone has sebaceous glands or other kinds of sweat glands, what we call apocrine glands, that are kind of on the inside that may produce more fluid. So it may be.
What are sebaceous glands?
They kind of secrete it's like a protein, like glossy kind of fluid material. And so they're in different areas of the body, and some of them are actually in the rectum. And so you can actually have somebody that sweats a little bit more, that maybe produces just genetically, they produce more fluid from those sebaceous glands or those glands than other people. So that can happen as well.
Michael Gibson asks or says, folks should also know, unless they specifically ask for a herpes check, it is not automatically included in the battery of STI screenings by most doctors.
I just had to talk about this with somebody else the other day. I had to talk with a student that asked me, Well, I got all these checks and they told me everything was clean. So I thought I was fine.
Yeah.
And I thought that included herpes. And I always tell people the tests that are included when you go to a medical office and you say, I want to get tested for STIs, sexually transmitted infections, they'll usually test you for HIV, syphilis, gonorrhea, chlamydia. Now, for our same gender loving men out there, what you're going to do is, depending on what you do, you're going to check for oral gonorrhea and chlamydia. You're also going to have a swab in your rectum for gonorrhea and chlamydia, because oral gonorrhea and rectal gonorrhea and chlamydia don't often show symptoms. But what we don't do as a routine, because it's not a great screening test, is test the blood for herpes virus, either type 1 or 2. The reason behind that is that herpes type 1, the strain of herpes virus that causes mostly oral lesions, cold sores, or fever blisters, is very common in the general population. So in some communities, some cities, 60-70% of people may have been exposed to herpes type 1 in the past. You could have gotten it from your grandmother. I think we talked about this before. You could have gotten it from your grandmother when she kissed you. You could have gotten it from kissing Sally when you were, thinking you were straight in 6th grade. All those things could have happened. And you could have gotten herpes that way, but it just won't show up as a fever blister. And then you get the blood test that says you have been exposed to herpes type 1. You're like, what the hell's going on? I haven't done anything. And people panic. So we don't do it as a screening test. So Michael's point is a good one, is that if you want to check for herpes and see if you've ever been exposed, that's what the blood test does. It won't tell you if you're acutely infectious with herpes. It won't tell you whether you're going to have a breakout or not. It won't tell you how the disease will progress. It will just tell you that if at some point in your past you've been exposed to herpes type 1 or 2. So that's something you can ask for, and most medical offices can get those tests.
I see a few more questions. I'm going to just do 2 back to back. James Lester wants to know, please discuss extra genital swabs. And Maurice Franklin asks, regarding anal health, how would you suggest you talk to your primary physician?
Yeah, so James asked about extragenital swabs. So that's what I was talking about. So guys, when you are going to get gonorrhea and chlamydia testing, please do not go. And if your doctor says, oh, you're just going to pee in a cup and that's gonorrhea, chlamydia, tell them that you have sex with other men, that you've been giving head, eating somebody's ass, getting your ass ate, whatever it is. If you bottom, tell them that as well. And you're going to get 3 sites. So you're going to get the urine test, you're going to have them swab your throat, and you're going to have them swab your ass. In a lot of clinics, what we're doing now is giving the patients the rectal swab, and you can go to the bathroom yourself and swab it yourself, and it's just as effective as if a provider did it. However, if you do have some lesions in the area, in the anal area, that you want the medical provider to look at, have them take a look down there too, and then swab the ass while they're down there. Now, the second question you said was what?
Regarding anal health, how would you suggest you talk to your primary physician?
Just mention that you bottom. You have to talk to people about that. And so realize that the medical profession is a very conservative profession. So a lot of doctors, a lot of nurse practitioners and PAs aren't going to, unless it's with an LGBT clinic, they're not going to ask those screening questions. So most physicians and medical providers will say, oh, what are you doing in school? Are you sexually active? Who's it with? But they're not going to get in the nitty gritty about your behavior. So if you have a concern, you have to be the one to bring it up. Because if you don't say nothing, they don't say nothing, nothing's happening. So you could say something like this, well, hey, I have a partner. Or if you don't have a partner, just say, well, when I'm active and when I'm having penetrative sex, I like to bottom. And so I'm worried about this. Or how is the best way I can maintain anal health when I'm bottoming? Those kind of things, conversations you can have. Now, some medical providers may nut up and freeze and not know what the hell to tell you. You can look up some stuff online, gather some information, and then bring it to your provider. That's always a good idea, because if you come armed with some information, they can read it, and it maybe takes the burden off them to actually come up with answers right at that time, but they can actually say yay or nay to whatever you're saying at that moment.
Wow. This is maybe related to the earlier point you made, but you may need to emphasize it some more. Can the STIs be found by a straight up blood test?
By a straight up blood test? Syphilis can. Syphilis is a blood test. If you consider hepatitis C, hepatitis B, those are both blood tests. And then herpes antibodies. Herpes antibodies, the proteins that the body makes to protect you if you've been exposed in the past. You have to already be exposed to it for those to come back positive. Those are the blood tests you usually get. Gonorrhea, chlamydia, or swabs are a urine test. HIV could be a finger test. an oral swab, a blood test, any of those things. So those are kind of the main ones that I would mention people have.
Awesome.
Okay.
Awesome. Well, do you have any final thoughts you want to share?
No, I think that's good. We did a really biomedical one today.
It was
Look
very
at you.
biomedically.
Right, we did. We did a real doctor revolutionary health today. Charles must be tired because he kind of he let it all on me. He's like, yeah, so let's do biomedical today.
I'm only going by what the people wanted.
I want you to tell them the story of why we wanted to talk about. Oh, you're not gonna talk about it. I don't even know the story for full, but I can say.
But I did want to talk about one thing.
Okay, let's go.
And I was trying to figure out how to frame it in my mind before I said it, and it's completely like a whole nother realm. It's also related to an email I got too, but just about how so sometimes as Black gay men, we will be in spaces with white men, especially where they feel like they can like touch us or take up a lot of space around us physically.
Right.
Even sometimes like touching us sexually. And they might think it's like, not a problem or whatever. If someone's in that situation where they feel like there's a disrespect of boundaries, and also recognizing like racial dynamics and what it means to be a Black man and things like that. What are some ways that we navigate those kinds of environments where we may like be in a social space or even a professional space, and we feel like there's and I'm particularly cutting it like with white, because I mean there could be many different ways that
people are inappropriate,
but particularly with white gay men or white men. What are some ways? So we don't want to get, we may not want to go to jail in that particular moment.
Right.
So there's that reaction. And we may not want to ignore it and just play like it's not bothering us.
Right.
But what are some?
I don't know if there's a quick answer to that. I think shutting it down as quickly as possible is kind of the way it's not. I think it's probably happened to a lot of us out there. You're at a party, you're at a pool, like somebody kind of comes up and gets in your space a little close. I think it's one of those things where you could either handle it where you just walk away, get up and walk away, move away, or you kind of verbally, tell them to back off or step down. Or you punch them in the face. We're not resorting violence here on.
We're not advocating for violence necessarily.
The counter narrative tribe does not advocate violence, but
not as a start.
Not as a start, right?
We'll lead with that.
Yeah, it may get
necessarily,
get
but we also recognize
it may get to that at a certain point. But I think it is about knowing your boundaries and knowing your spaces. And some people welcome certain kinds of flirtatious advancements, and then it may go too far, or it's just completely unwarranted. You're standing there and someone grabs up on you or thinks they can grab your dick and say, oh my God, look at this. And you're like, just because you're in a gay space means that they can do that. Like, what would you recommend?
Or even sometimes there's also just, it might not be as aggressive as like grabbing someone's but it could be just like just their closeness to you, or like just like the boundaries.
Well, I'm the wrong one to talk to about that, because I don't like people being in my space. If I stand at Starbucks and someone comes up on me too close, like I'm literally looking back on them like I want to elbow them. So I don't like anyone getting in my space. So I'm probably far along on the continuum as far as extremes, because I just don't like people being in my space at all.
Yeah, but I think it happens a lot, just different. And I think it's just a larger conversation about how because I feel like there's a conversation about like homophobia and how we're going to deal with homophobia and all this and that, but there's also a lot of rampant anti-Blackness, and I don't know if we always get the tools, like what does it really mean to navigate the litany of microaggressions that we face, particularly as it relates to racism.
Right, and anti-Blackness can manifest as like fetishizing or objectifying or feeling like, I can touch you whenever I feel like it, and so how do you kind of combat that craziness from jump? I don't know if there's a right answer to that.
Yeah, because I imagine that there are people that might be watching this that might be going through that, or might have experiences where it's like you're trying to figure out how to respond.
An open-handed slap in the mouth sometimes works. Open-handed slap in the mouth. Be done with it.
I see a question here. Is the follow-up to Charles's question about inappropriate touching by white men in certain spaces. What if you're in that situation where there are Black men who are welcome or encouraging that type of behavior?
Charles? You gonna answer that?
I mean, I think everybody's different. I mean, I think ultimately you have to. I mean, the way that I operate is, am I gonna regret? Am I gonna regret inaction? You
Right.
know, like I'm someone where, I have to be okay with myself, and I have to, um, yeah, I just like I have kind of an advocate spirit, but I recognize that situations are different.
Right.
Like I know I've been. We kind of talked about a situation you had on social media where someone said some really inappropriate stuff, like a colleague. We're not going to go too deep, but where someone in your life said something kind of racially insensitive.
I've had a few things
We had a few
happen. So,
things
yeah,
happen,
so I'm trying to
and it's
recall
like, how
which
do you?
actually one it was.
Yeah,
Yeah.
but it's. I mean, but I
Well,
don't know if we ever did it. But I think. I mean, what do y'all think? Like, Jay Bernard Jones. I know you're asking this question, but what do you think about in situations where black men seem to encourage? I guess you're saying black men encouraging inappropriate touching by white men to other black men.
right.
Like, what are y'all's thoughts about that? I mean, because
Right.
there is complicity, and
Oh,
sometimes we
absolutely.
might be in situations where that might happen.
Right. Right. It's a good point by
Mm,
Bernard. I think, kind of making the point that we could be complicit in that, or we can be the perpetuators of that as well. It's not just white
mm.
men have a corner on the market, but I think when white men do it, it has a very
I mean, there's
a
a thing
different
about power,
dynamic,
especially when there's a
power,
power situation.
slavery, all those kind of foolishness things that go on. So yeah, it,
Yeah,
it takes on a whole different meaning.
but I think that's something we should, continue to think about, like ways that we can have tools to navigate. Because I think a lot of times we end up in, we it happens and we have to respond and react.
Right.
But we have to figure out how to support each other. I mean, there are
Right. Right.
obviously several kinds of reactions.
Right.
Um, but know that it's not okay. It's not okay, and that because I think sometimes we might justify, might say, oh, what did we do? Did we, create this situation?
Did we invite
Did we invite
this?
this? Yeah.
But we wouldn't be saying that if it happened when a
Mhm.
female and a male kind of did that to her. Like you wouldn't say, well, what you wore kind of invited. You shouldn't have worn what you worn, or you shouldn't have acted like you did, or you shouldn't have flirted like you
Mhm.
did. That invited him to do that. So I think the same rules apply.
Yes. Yeah, I think it's like they just like got me thinking about so many
Open-handed slap in the mouth.
situations.
I forgot who said that.
David's not a pacifist, by the way. If you haven't noticed, David's not a pacifist at all. Are we having a? Are you Kilimanjaro?
I think that's what it was. Right? I'm trying to remember who the name of the person was that did that.
Did you call like a colonizer at the Starbucks?
A colonizer, no.
Yeah, but we got. I mean, as Black women, we have to be in conversation about that, like
Yeah.
how to support each other as we stand up for ourselves. That's so important. Like I know I've seen situations where when Black women have stood up for themselves, even aggressively, that we don't support them and don't stand behind them.
Right, and it's also like it's a common rule of thumb. And I saw LeBron James say this the other day because he was talking about how I think it was Lance Stevenson for the Indiana Pacers. He like goaded him to do something. Then LeBron reacted, and LeBron got a technical foul. And LeBron, they asked him about it later on. And he said basically it's like in class where someone tells you a joke or someone shoots a spitball at you, you react, and then the teacher sends you to detention, or you get in trouble with the teacher. It's usually people focus on the reaction rather than the action. So if you allow that person to cause you to do something violent or extreme to them, they look innocent and they look like victims, even though they were actually the perpetrator.
Exactly.
And they're not going to do that because that's just the way this world works. We tend to focus on the reaction than to the action that actually precipitated that.
Or I mean, I think many of us have been in professional situations where people have maybe made jokes,
Right.
or like I remember one time I was at I was at work at this other when I worked at another organization. I'm not gonna say which one, and one of my colleagues, they were talking to the white gay men, and one of them said something like, they were like impersonating, like I guess what they thought was ghetto, like talking ghetto. And oh my god, they were gonna have to come get me because I was like, because you always have to give the speech. I don't know what y'all used to dealing with, but
Right.
I'm not that one. Like I'm gonna say, the person like, oh, I didn't mean, I didn't mean that and all that. But no, I just can't like let that slide.
Right, yeah.
Even the stuff that they didn't even take seriously. It was like, no, we're not doing that today.
I'm not the one.
All right, y'all. Well, this has been an amazing conversation. David got to enlighten some folks.
Got to play doctor tonight.
You got to play doctor. I'm sure you have lots of.
Yeah, check out if you think you have sleep apnea, get it checked out. And if you have rectal bleeding, take it seriously. and follow up with it. And asses don't come.
Ooh, on a final note, Ben Robinson says, y'all need new t-shirts that read "No means no colonizer." I think we might
I
actually
love
we are
that.
going to do
Thank
that,
you,
Ben. You
Ben.
just don't
Come
know. We are going
on.
to do that. So we're going to be, so join us every Tuesday evening. We usually do 7. We did 8 o'clock tonight. I know some people noticed that we did an hour later. We usually do 7,
Right.
but we had an advisory board meeting at 7 today. So we started, but normally every Tuesday at 7 o'clock, please join us. Tuesdays at 7. Also, please subscribe to our YouTube channel. If you're watching this on YouTube, please like this video on Facebook if you're watching it on Facebook. And please join our email list at thecounternarrative.org. Thank y'all.
Amen. Talk to you later.